everybody. Thank you so much for having me here today. It is truly an honor to discuss this topic with you that is near and dear to my heart. So I want to get something really straight that Yolanda did touch on. Women's health is not a charity. It's not a charity case, and it is not at all about virtuous. It is one of the most viable, most scalable, and most overlooked investment opportunities of our time. And I want to set the record straight on that before we talk about literally anything else. McKinsey recently estimated that if the United States were to close the gap in women's health, it would unlock a $400 billion unmet GDP opportunity for our country and $1 trillion globally. So to put that in perspective, in just the United States, that's the size of the entire U.S. agriculture industry. So this is not theoretical and it's not kind of like a fun idea. This is the immediate, real world bottom line impact. And it is sitting literally right in front of us. And right here in our own backyard, I am excited to share, for those who may not know, Reagan's Oximetry, which is a portfolio company, Exceplus Fund One Portfolio, just announced a strategic partnership with GE Healthcare, which is a global leader in fetal monitoring. Their market cap is approximately $32 billion. They're taking this very seriously. So congratulations to Reagan Oximetry and to their founder, Neil Ray, and his team for making such big strides to forge this path, not just for health, but for the viability of women's health as an actual emerging trillion-dollar new industry. So there is quite a lot to talk about in terms of the discussion that's being had all over the news and in society today about one of the new economic engines in our country. Well, what I'm going to say to that is it's right here. And we don't need to go to space to find our next growth sector. It's in our bodies, it's in our homes, it's our mothers, our sisters, our daughters, and us. And it's been ignored for decades. So one of the questions I often get, especially as an investor from LPs, is why is this massive market just so invisible? If it's so big and so real, why is it invisible? I believe that for generations, women have been taught that accepting poor outcomes for our health is wrong. We have been excluded from clinical trials until the 1990s. I can go on and on and on, but we're still very underrepresented in clinical data. Because the standard of care for women's health is very outdated, has tended to be misinformed, and is it's pretty incomplete. It has created such an opportunity, and I think this is also just unacceptable. In 2023, I myself nearly died from my own pregnancy. I have preeclampsia, and I didn't fit the profile. I didn't trigger the signals the way that they believed that I should. I was healthy, going to all my appointments, and I was at one of the top hospitals right here in the East Bay. But all the signs were missed. For maternal health in the United States, it ranks among some of the highest in maternal health mortality compared to other developed nations. And in some of the states in our country, such as Mississippi, Texas, Oklahoma, and Arkansas, those states don't rank much better than some of the underdeveloped sub-Saharan African countries. And that is also very unacceptable. But I want to be clear. Women's health is not limited to reproductive health. Yes, reproductive care matters, but women's health spans heart issues, autoimmune conditions, mental health, menopause, and so much more. When we limit the definition of women's health to reproductive health alone, we're telling women that their health only matters in the context of their ability to make babies. And that's not only outdated, but it's dehumanizing. 67% of Alzheimer's patients are women. Women make up 80% of autoimmune disease cases. Women are misdiagnosed with heart attacks 50% of the time. Why the misdiagnosis of heart attacks? Because women often experience a more microvascular form of heart disease, which is less like the massive widowmaker hard tax that typically will impact men. And endometriosis increases a woman's risk of stroke by as high as 20%. So yet we just still treat women's health like it's stress or anxiety or hormones. And so it's not just misdiagnosis, it's a lot more than that. So the solution isn't more of the same. It isn't continuing to try to do what we're currently doing better. It's innovation. And anytime the solution is innovation, there is a massive opportunity for everybody here. This is what makes women's health so unique and so exciting as an opportunity. It's not just high need, it's high demand. Women are 51% of the population. We make up 80% of US household healthcare decisions. And imagine what happens when capital and technology and innovation could all finally catch up. So I see this as a generational opportunity for all of us. It's not a trend, it's not a niche, it's a movement. And only a small handful of investors are currently capitalizing on this movement, and a few of them are in this room. So, as you know, you can't move capital if nobody knows that the market is real. Well, it is real. And if you're in this room, you now know it's real. So, to the investors here, this is your semiconductor moment. I like to say this is kind of like today's homebrew computer club, where little pockets of innovation are occurring in different spaces. It's the one that you'll wish that you wanted to earlier. And there are a handful of people who are doing work, but the door is wide open for anyone else to step in. The founders here build like women's lives depend on it, because they do. And we're not just solving problems, we're creating a future where women and girls don't just survive, they move on. And to the business leaders and the city officials, what if this region could become the hub for women's health innovation? What if we could become the driver of that $400 billion GDP opportunity? This is something that Silicon Valley did for semiconductors back in the day. If there could be an economic engine created here, and this market could be owned. And as far as I know, no area has really claimed it. So before we go, I want to address an elephant that is in many rooms. There's a lot of politically driven fear right now about women's health. It's even becoming taboo to use the word woman. And so far, the religious right or those who fear them, this is something that benefits them. And I'll say this: women are a creation of God also. It is now time to stand up to fear and to stand for what is true. The waters may be rising and the ground may be shaking, but we hold these truths to be self-evident that all men and women are created equal, and we are endowed by our Creator with certain unalienable rights. Among those are life, liberty, and the pursuit of happiness. So, creating abundance and generating a new massive industry for women's health isn't taking anything away from anyone else. We're not removing from one sector. Nobody is going to not benefit because women benefit. It's all about expansion and adding a whole new world that we are all ready for. So my call to action is let's build this together. Thank you.